years male patient is coming to the ED and complaining tightness of chest.
30 years old male coming to ED complaining with tightness of chest.
So you are there for this patient.
Okay. So I'm coming. Scene is safe.
Scene is safe, sir.
Scene is safe.
Safe.
भाई साहब आप ठीक हैं?
Sir,
भाई साहब आप ठीक हैं?
Sir, I am okay.
He's okay.
Yeah, he is okay. He's
So
talking,
good.
sir.
So एक चीज बताइए आपको कब से दर्द हो रहा है?
सर मुझे 2 घंटे से थोड़ा टाइटनेस फील हो रहा है मेरी चेस्ट में.
Since the patient is able to talk, I can understand the airway is okay. What about the breathing status?
So it's adequate.
What about the respiratory rate, the SpO2?
Sir, respiratory rate is taking breath at 18 per minute
Okay.
with SpO2 of 94%.
So respiratory rate is okay, SpO2 is okay, no need for oxygen supplementation. What about the circulation? Now I will apply the ECG electrodes. Can you tell me about the heart rate, the blood pressure?
Sir, his blood pressure is 100 by 60.
100 by 60.
And you have attached electrode and the rhythm is Brady sinus Brady.
Can you just show me the rhythm?
Sir,
So my patient is stable. The patient has a stable blood pressure. I'm trying to analyze the rhythm. I've checked for airway, the breathing, and now I'm there in the circulation. I'm yet to see the rhythm, Mr. Dharmendra. I'm yet to see the rhythm. Now, because the patient has a stable blood pressure, the patient is onto the stable part of the alveoli. You want to show ready? So there you
code is one, sir.
In the meantime, ECG is being applied. Disability I will assess for D, and the D looks okay for the patient. What about the exposure? I will expose the patient. You will have to give me the rhythm. So I will expose the patient. Look for any metal bracelets. Look for. Still, there is no ECG rhythm. So can you ask for a help? So Mr. Dharmendra, I need an ECG. Can you ask for a help?
Yes.
Somebody, yes, so that I can also see what kind of rhythm analysis is pending for this case. So I have checked for the airway, I have checked for the breathing, the airway looks painted, there is no gurgling sound, the patient doesn't need oxygen supplementation. In the breathing, the patient is breathing at a rate of 18 per minute, SpO2 is 94, patient do not need any oxygen supplementation. In the circulation, ECG rhythm is yet to be analyzed, but the blood pressure is 100 by 60. In the D, disability, the patient has no disability apparently visible. In the E, on exposing the patient, भाई साहब मैं आपके कपड़े हटाऊंगा देखने के लिए कोई प्रॉब्लम तो नहीं है, कहीं पे कुछ चोट के निशान या कुछ ऐसा कैथेटर जो डला है जिसकी वजह से आपको कोई प्रॉब्लम हो रही है. So I have exposed the patient and there is nothing visible which is obvious like metal bracelet, no bruising, no any trauma marks. Okay, so do we have the ECG by now? Yes,
So
good.
you have ECG like this.
Thank you, Mr. Dharmendra. Now the ECG is there. So now I can see that the patient is having sinus bradycardia. So the BP is 100 by 60. Yes, Mr. Dharmendra?
Sir.
Okay. So
Now,
BP
sir,
is 100 by 60.
This rhythm being changed and it is showing like this on the monitor.
Okay. So now there is suddenly change in the rhythm. There is suddenly change in the rhythm. भाई साहब आप ठीक हैं? भाई साहब आप ठीक हैं? So there is no response. I need help. Please come. Dr. Ankit, I want you to be there on airway.
Yes.
Dr. Anupam, you please be there on to the chest compression. I want you to be there on chest compression. Yes. Who is the third? I want you to be there on defibrillator. Mara?
6, 7, 8, 9.
Do we have other two members?
Yes,
I want you to record. I want you to record the events. I want you to go for IVI, please.
23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 1.
So, who is on defibrillator? You continue with the chest compression. Yes.
So same rhythm is coming.
14, 15, 16, 17.
Ventricular fibrillation. Do you have any suggestion?
Sir, I would like to go for the shock.
Yes, please.
30.
Give 360-degree monophasic shock. I want you to focus on this one, please. I want you
I
to
am
focus.
clear, everyone clear, clear
Okay.
oxygen, shock given, connect oxygen,
So I
continue
want-
CPR.
Thank you. Thank you. I will let you know, Suman, in case if I need your help. Continue with the high quality chest compression. Push hard, push fast, allow complete chest recoil. You have to be more fast. Are you comfortable with the breathing?
Yes.
So for every 30 chest compression, you have to give 2 breaths, right?
So,
So,
cycles
uh,
of CPR are completed.
Suman, can you help me in establish EDCO2 monitor with the bag and mask?
Yes.
So after 2 minutes, we will reassess the rhythm and then we will take the next decision. So in the meantime, I want you to prepare 1 milligram of epinephrine, but do not give unless and until I ask you to do so.
4 cycles of CPR
So 1
completed.
milligram of heparin loaded and ready.
Khushbu, you let me know once the 2 minutes are done. We don't have to see the rhythm in between because only after 2 minutes we have to reassess the
2
rhythm.
minutes of
Okay.
CPR completed.
So 2 minutes of CPR is completed. I want you to reassess the rhythm. 2 minutes CPR has been, please. Rhythm analyze.
Sir, rhythm-
Patient is still having a shockable rhythm.
Yes, sir.
So please prepare for the shock.
And
I want
rhythm has been changed.
Okay, good. So
Patient
sinus
can do the
I want you
sinus.
to rotate otherwise. Make a switch. Doctor, can you feel for the pulse?
So after 2 minutes, this rhythm is showing on the monitor.
Okay.
Yes, pulse.
So can you feel for the pulse?
Yes.
Can you feel for the pulse?
So
Pulse is there? Okay. So there is a return of spontaneous circulation. I want you to confirm with the EDCO2 capnography. What is the EDCO2 value?
so it's
Just
36.
36 is the EDCO2. Good. Good guys, there is a return of spontaneous circulation. You have to continue giving a breath for every 6 seconds, right? So great going guys. Let's revise in between the 6H and 6Ts for this case. What do you think could be the cause which has led to this event of cardiac arrest? I need suggestion because I'm not getting here. Okay, so good suggestion. Can you just draw the samples and send it for hypo and hyperkalemia evaluation? Apart from this, I also want you to take the samples for the routine investigation, including ABG. Okay, great. So Subhash, what do you think we are missing? What has led to the rhythm from the bradycardia which has terminated to the VT, pulseless VT or VF? Very good suggestion.
So sample sent for the routine
Good.
investigations and this is the ABGs.
Okay, great. So the patient is having ABG of 7.25. There is acidosis. PaCO2 is around 36. Good. You are doing a good, great ventilation, Anupam. The bicarbonate is 15. There is acidosis. The potassium is 6.9. So I think you were having a great suggestion. So I want you to give. Who is there on IVIO? So Nupur, Dr. Nupur, please give 2 ampules of calcium gluconate over a period of 10 minutes. And I also want you to give 50 milligrams of soda bicarbonate as a slow IV over a period of 15 minutes. Dr. Nupur, I want you to repeat my instructions.
Sir, I gave 2 ampules of potassium, calcium gluconate over 10 minutes, and then I'll give 50 milliequivalents of soda bicarb
So can
in
you
the
give
next
it?
15.
Thank you, Nupur. Thank you for
Starting with
confirming.
the calcium gluconate.
Okay. So once you are done, you let me know. So it's great. We have been able to discover among the reversible causes, HATs, it was hyperkalemia. So now we have achieved the ROSC. So I want you to focus on post-cardiac arrest algorithm. So what we have to do next, can anybody help me in understanding? Because I'm not available.
Airway mask.
Okay, so airway management, what do you think is there?
ET tube should be.
Very good. So I want you to secure endotracheal tube. Are you comfortable in putting up the endotracheal tube?
Yes.
Or you need somebody else help?
Sir, I am
We have Dr.
comfortable.
Ankit also is available.
Sir, yeah, he's there by my side. That is good, but I am confident that I'll be.
Okay, great. So please go ahead. In case if you fail to do so, please take the help of Dr.
Sure.
Okay. So endotracheal tube is done.
Yes, sir.
So 1 breath after every 6 seconds.
Can I have
okay.
2 minutes syringe?
Yeah, it is done. Okay, it's done. Thank you, Anupam. Just continue with the back. Just continue with the 1 breath every 6 seconds. Connected to the ventilator. Yes.
So I've connected with the capnography.
Anything next? Yes. Very good suggestion. So connect to the EDCO2 and maintain a PaCO2 of 35 to 45. Anything which you are missing, Dr. Suman and Vidushi, which you are missing in this case?
Check.
In the post-cardiac arrest? Yeah.
B3 of the patient.
Very good suggestion. Thank you. You know, I was missing on this part. So can you just check the blood pressure?
Sure, sir.
What is the BP?
BP now 110 by 70.
Very good. So I think we are on the right track. Our patient doesn't need any inotrope or vasopressor, right? Anything else? If anybody can help
to
you.
have 12 ECG.
Very good. I think that is something which we have to exclude because it could be a potential case of acute coronary syndrome. So can you just take a 12 lead ECG since you are there on monitor?
12 lead ECG has been applied and it has been taken shipped as my single.
Okay. So 12 lead ECG is there.
Yes, sir. This is the 12 lead ECG.
Very good suggestion. This patient is having ST segment elevation of 3 mm in all the precordial chest leads. I think we are dealing with the MI. This patient has to be shifted to the cath lab as early as possible, right? So can you just take a consultation from the cardiology? Are you there with us? Okay. So can you just take a consultation from the cardiology? Tell them, inform them there is a post-cardiac arrest patient who has achieved the ROSC and the patient has ST segment elevation of 3 mm in the precordial chest lead. We are suspecting this case to be a case of STEMI. Patient will need primary PCI. Thank you. Okay. Anything else in the meantime which we have to do? Can you just assess for the disability? How the patient is placed in terms of the GCS, AVPU?
So I check the pupil. Pupils
Okay.
are bilaterally equal, sluggish in reaction.
What about his response to the painful? Is he responding?
So he's opening his eyes to the pain.
So he's responding. So only on the pain he's making a response. So it looks like the patient has suffered some neurological injury. So I want you to arrange this patient for TTM.
Yes.
So use an endovascular cooling blankets or a surface cooling blankets and put a nasopharyngeal temperature probe and maintain a temperature of 32 degrees Celsius for the next 24 hours. Right?
Yes.
And I want you to arrange the EG monitoring for this patient. Most likely the patient will go to the cath lab. After the cath, the EG will be applied. Okay? Anything else guys which we are missing? So the primary PCI, I think the decision will be taken up by the cardiologist.
Sir, I have informed the cardiologist.
Good.
They said what is the time? They asked me to कितना time के अंदर So I told you it's half an
So
hour.
the patient has reported to us within 30 minutes.
Yes, sir. We told you urgently shift to the cath lab and we will.
Thank you for the suggestion. I think it's time for the patient to be shifted to the cath lab. Thank you guys. Thank you for the great exercise. Thank you.
What is TTM?
Targeted temperature.
Temperature. You bring out temperature 34, 35 degrees by giving cold saline. And then he asked him to talk to the cardiologist. The patient at TTM is undergoing hypothermia for self-protection. Can be shifted for the PCI or not? That is my question. You're doing target temperature management, you brought down temperature 34, 35. He's spoken to cardiologist at the same time. Now cardiologist shift the patient to cath lab. But he's under TTM, temperature 34 now. We have brought down 34, 35. Can you shifting patient to cath lab or not?
So if at all it is necessary with a very high risk consent, he can be shifted, but ideally should not be, sir. But his return of spontaneous circulation and his maintenance is dependent on opening the block of the artery.
But
We have to open the block in the artery.
yes. So even
have to-
hypothermia, patient at TTM can be shifted to cath lab for the PCI. That is one point I wanted to convey. Okay?
Thank you. Anything else, Dr. Shiva, where I missed? The patient is unresponsive, I need help. Let's say there is a delay in the help, then you continue with the exercise. But if the help is promptly available, which happens in your ICU or ER, then you have to do it then in the research. Okay? First and foremost, delegation of role and responsibility. What to communicate and how to communicate. मैंने तुमसे पूछा ना कि कौन सी दवाइयाँ हैं, तो तुमने क्या बोला? 20 ml of potassium. Did you realize? Because there was a problem. I gave the instruction which I gave was actually too much. I have to reform this instruction. Maybe I should have told her, oh, can you just get 20 ml of calcium gluconate? Done. Over 10 minutes. And maybe later on I could have asked my carpenter. So I have to understand the limitations and an expertise of the person who is on IVI. If I'm giving too many instructions, there are high chances it will cause adverse drug errors. And that is the reason why I asked specifically, can you repeat my instructions before you give? Because there was a doubt which I was having. Okay? So shall we repeat?
Just 1 minute point, please. The morning what I told high performance teams. It's a teamwork, na, basically. There are 5 or 6 members of the team. Somebody is on airways, somebody on defibrillation, somebody on IV. It's a teamwork. High performance team. And that the high performance team works effectively, outcome is better. In this comes the role of team dynamics. What is team dynamics or group dynamics means how the team leader communicate with other team members. Like you are the team leader, how to talk to the person on the airway, how to talk to the person on the IV. So you tell the person on the IV clearly give injection 1 mg epinephrine. So he or she on the IV line must repeat, yes, 1 mg IV given,
Yes.
20 minutes line push given. So it is completing the loop basically, closed loop communication. You have told me something, I must repeat back, this work is done.
Yes.
Every action done is very important. Na? Suppose you have not had 1 minute, you are not, then you are in doubt in your mind. So they have to improve the team dynamics or group dynamics. Then only team becomes high performing team and leads to improved outcome.
So